Hello, my name is Rachel Lovin, and my project is on the effects of political partisanship on COVID-19 case metrics in North Carolina. For this project, I worked with a research team of Reese Bowie, Sarah Jennings as statistician, and Dr. Perez-Hedrick as faculty mentor. This project is based on a previous project which I worked on with Reese and Dr. Perez-Hedrick in summer 2021. According to multiple nationwide surveys, even in the early stages of the pandemic, initial attitudes differed based on partisanship. Self-identified Republicans indicated that they were more skeptical of COVID and less likely to follow CDC guidelines such as social distancing. In addition, studies tracking movements on a county level through cell phone data indicated that between March and May of 2020, residents of Republican majority counties spent more time away from home per day on average than residents of Democratic counties. In addition, between March and August of 2020, strongly Republican counties had both a higher case growth rate and a higher death growth rate than Democratic counties. When it comes to vaccination, a survey given prior to vaccine availability indicated that self-identified Republicans would be more hesitant to take a potential COVID vaccine than self-identified Democrats. This is supported by a study of county-level vaccination rates, which showed that Republican-majority counties had lower vaccination growth rates than Democrat-majority counties. In addition, studies indicated that when a state has a Democratic governor, stay-at-home orders and executive orders result in a similar decrease in time spent away from home among counties, regardless of partisanship. The research questions I was asking for this study were: first, are county-level transmission and death rates associated with political partisanship? Second, is county-level vaccine coverage associated with political partisanship? And finally, are county-level responses to statewide executive orders associated with political partisanship? Our study variables differed depending on which questions we were looking at. For the first and second questions, the variables were the same. The independent variable was political partisanship, which we measured as the percentage of a county which voted for Donald Trump in the 2020 presidential election, minus the percentage of the county which voted for Joe Biden. If this number was negative, we classified this county as Democratic leaning. If the number was positive, we classified it as Republican leaning. The dependent variables corresponding to partisanship were weekly incidence and mortality rates, as well as vaccine coverage, which is the percentage of a county's population that is vaccinated. The confounding variables include the Social Vulnerability Index, which attempts to determine which communities are more susceptible to health stressors. In addition, we used cumulative incidence rate, which is the number of new cases of a disease divided by the number of individuals in the population at risk for this disease during a specific time interval. For the final research question, the classification of executive orders as either restrictive or relaxing restrictions was our independent variable. Restrictive executive orders could include social distancing mandates, mask mandates, school closures, or stay-at-home orders. And executive orders which were relaxing restrictions were those which removed any of those restrictive executive orders. For the confounding variables, cumulative incidence rate and social vulnerability index were confounding variables as well. However, in this case, vaccine availability and vaccine coverage were also confounding variables, because when these executive orders were being issued, vaccines were either not available or were just being rolled out, meaning that counties with a higher population of at-risk people may have had a disproportionately higher vaccination rate at this time. In addition, our dependent variables were case growth rate and death growth rate. We took our data from the website of the North Carolina Department of Health and Human Services, as well as the state government website, and we fit a series of generalized estimating equations to the data to evaluate the effects of political partisanship on county-level incidence, mortality, and vaccine coverage, as well as whether political partisanship influenced the effectiveness of statewide executive orders on county-level COVID metrics. So as for our first question, are county-level transmission and death rates associated with political partisanship? The chart on the left shows the average weekly incidence rate per 10,000 people for the Alpha, Delta, and Omicron waves. In the first two waves, Republican counties had a higher average weekly incidence rate than Democratic counties. However, during the Omicron wave, there was no significant difference in average weekly incidence rate. Also, in the Omicron wave, average weekly incidence rate was significantly higher for both Republican and Democratic counties than it had been either of the previous two waves. On the right, we have an overall epidemic curve, which is stratified by partisanship, which matches the data of the chart on the right, as during the first two waves, Republican-leaning counties had a higher average weekly incidence rate. However, during the Omicron wave, both Republican and Democratic-leaning counties had points where they had a higher weekly incidence rate, so it kind of averaged out. As for the average weekly mortality rates, these results somewhat mirrored the results for incidence rates. Mortality rates were highest in the Alpha wave, likely because this was the beginning of the pandemic and vaccines were not widely available. And throughout all waves, Republican-leaning counties had significantly higher mortality rates than Democratic-leaning counties. For our second question, is county-level vaccine coverage associated with political partisanship? The chart on the right maps overall vaccine coverage to a county based on how strongly partisan it is. The further to the right it is, the more Republican-leaning a county is, and the further up a dot is, the higher percentage of the county's residents are vaccinated. Additionally, on the left, we have two maps, the top map representing vaccine coverage, where darker counties are more vaccinated, the bottom map representing partisanship, where bluer counties are more strongly Democratic, redder counties are more strongly Republican. And these charts altogether indicate that there is a strong correlation between a county leaning Republican and this county being less vaccinated. For our final question, are county-level responses to statewide executive orders associated with political partisanship? This chart depicts the effects of executive orders on case growth rates. In the pre-vaccination period, restrictive executive orders resulted in a significant decrease in case growth rates, while relaxing of restrictions resulted in a significant increase. However, after vaccines became widely available, neither restrictive executive orders nor those relaxing restrictions had a significant effect on case growth rates. In addition, there was no significant difference in Republican and Democratic-leaning counties' responses to statewide executive orders. This chart displays the effects of executive orders on mortality growth rate. The results are similar to those for case growth rates. It's important to note that since the last executive order was relaxed in summer 2021, this analysis only encompassed data from the alpha wave of the pandemic. And as for our results and discussion, our results were mostly corroborated by the previous research that we had looked at. We found that county-level transmission and death rates were associated with political partisanship, as Republican-leaning counties had higher average weekly case rates than Democratic-leaning counties during the first two waves of the pandemic, and Republican-leaning counties also had higher average weekly mortality rates than Democratic counties during all three waves of the pandemic. We also found an association between political partisanship and county-level vaccine coverage, in that Republican-leaning counties were more likely to be less vaccinated than Democratic-leaning counties. And finally, we found that county-level responses to statewide executive orders were not associated with political partisanship. However, in the pre-vaccination period, we did find that restrictive executive orders decreased case growth rate significantly, and relaxing of restrictive executive orders increased case growth rate significantly. For further research, I would be interested in identifying additional confounding variables for analysis. I would also like to try stratifying our data based on age, as one study I saw indicated that members of a certain party who are younger may behave differently than members who are older. Finally, I would like to cover a larger sample of states with varying political balances, because I think it would be interesting to see how states that are governed by Republican governors, how the counties within those states may react differently to statewide executive orders, as I saw a study that indicated that might be the case. Here is a list of my sources, and I look forward to taking any questions you may have. Thank you.